Good afternoon, and thank you for joining us today for our weekly press briefing with an update on COVID-19 here in Erie County. Today, I'm reporting that we have 12 new cases of COVID-19 and 1 new death to report in Erie County as of 12:01 a.m. That brings us to a total of 691 cumulative positive cases since the beginning. We currently have 539 recovered cases, leaving us with 137 active cases and a total of 15 deaths. We've had 12,664 negative tests reported. Of the cumulative cases in Erie County, 58% are female and 42% are male. The breakdown by age is 4% are ages 0 to 4, 2% ages 5 to 9, 5% are ages 10 to 18, 15% are ages 19 to 24, 42% ages 25 to 49, 19% ages 50 to 64, and 13% are ages 65 and older. Regarding race and ethnicity of our cumulative cases, 49% are white residents, 33% African American or Black residents, 5% Asian residents, 2% other, and 11% unknown. And please remember, sometimes our numbers don't add up to 100% exactly due to rounding. Regarding Hispanic origin, 10% of the total are Hispanic of any race, with 76% non-Hispanic and 14% unknown. I know people appreciate the reporting of these stats, and we're hopeful that we will have an even more robust reporting system to bring to you with overall effectiveness, showing overall effectiveness in the future. And with that, I am proud to announce that 3 epidemiologists from the CDC arrived at the Erie County Department of Health just this past Monday to assist our local health department with this very thing and much, much more. One of these individuals is a state-based epidemiology and surveillance manager. One is an infectious disease epidemiologist, and one is an epidemiologist and epidemic intelligence service officers. So we are very, very grateful that they are here in Erie County, and I think myself and all of us look forward to sharing and hearing about the results of their assistance in the next few weeks. As I mentioned, 539 people in Erie County have recovered from COVID-19. And while that is very wonderful news, many of the recovered cases still have lingering conditions, including respiratory issues and difficulty breathing. We must continue to wear our masks and physically distance ourselves and practice good hygiene. And please stay away from anyone you know who is ill. I continue to see and hear reports of crowds gathering where no one or very few people are wearing masks. Are the risks worth it? I urge you to think about others, especially the most vulnerable people that you know and love. Be a superhero and wear a mask. Even at the beach, if you can't keep 6-foot distance from others that you don't live with, please wear a mask. Research shows that wearing a mask helps to fight the spread of COVID-19. I was just reading this morning that face masks could save as many as 45,000 lives in the United States by November if 95% of us would wear a mask in public. The director of the Institute for Health Metrics and Evaluation at the University of Washington believes that mask wearing is a simple strategy to save lives while also helping the economy because it helps us avoid the shutdowns that had happened prior and that we see happening in other communities currently. With so many unknowns surrounding this life-threatening virus, even if there's a small chance that wearing a mask could protect the people around you and protect yourself, isn't it worth it? I continue to praise our businesses who are really helping us to slow the spread and enforce the mask wearing inside their establishments. These businesses are doing their best to be superheroes for our community. And that brings me today to our star player, a business that's doing this very well, and it's Plantscape Greenhouses in Fairview out on Route 5. They have clearly marked entrance lane and exit lane, social distancing markets. Everyone is wearing a mask who works there. Everyone who comes in there is required to wear a mask, and they are doing many, many things to try to help keep the guidelines in place and to do the right thing for our community. So thank you to Plantscape Greenhouses. And thank you to this star player and to really so many of our businesses and our residents who are working hard to follow the guidelines each and every day. And with that, I would now like to invite David George, who you've seen on with me before, the Supervisor of Environmental Health Services at the Erie County Department of Health, to share an update, particularly around businesses and activities and mask wearing. David?
Thank you, County Executive. Late last week, Secretary Levine signed an order requiring universal face coverings. This order was implemented to further slow the increased number of cases in the state and avoid overwhelming the healthcare systems, which has been seen in other states throughout the country. Face coverings are required when you are outdoors and unable to consistently maintain a distance of 6 feet from others, such as on a busy sidewalk or near others at a congregate setting. In any indoor location where members of the public are permitted. Waiting for, riding on, driving, or operating public transportation or in a taxi, private car, or ride-sharing service, or obtaining service from a healthcare sector. There are a few exceptions to the face covering requirement, including persons who cannot wear a mask due to a medical condition, a situation while working that would create an unsafe condition to operate equipment, persons who would be unable to remove a mask without assistance, and individuals who are communicating with someone who is hearing impaired. If an individual is unable to wear a face mask, a plastic face shield that covers the nose and mouth should be used in place of a face mask when possible. Your mask protects others around you, and their mask protects you. So by wearing a face mask covering, you are protecting those closest to you. The order applies to all individuals and school entities for anyone aged 2 and older. Schools may allow students to remove their face coverings when students are eating and drinking spaced at least 6 feet apart, seated at desks or workstations at least 6 feet apart, or engaged in any activity at least 6 feet apart, such as mask breaks, or recess. With regard to athletics and sporting activities, a mask must be worn unless they can consistently maintain social distancing of at least 6 feet. An example of this would potentially be tennis and golf. Any sport where you are potentially within 6 feet of someone, such as basketball, baseball, soccer, or football, masks must be worn. Masks must also be worn on the sidelines, in the dugouts, and by all spectators. We are all in this together, and we want to keep Erie operating in the green phase. This universal mask order, along with social distancing, good hand hygiene, and avoiding touching the face with your hands practiced by everyone, will keep the number of cases in Erie County low. Businesses are trying to do the right thing. It is up to everyone to follow these guidelines so that we can keep the businesses in Erie County open and thriving. Lastly, the Department of Health released a statement that recommends you quarantine at home for 14 days upon return from an area with high amounts of COVID-19 cases. And you need to quarantine upon return from the following states: Alabama, Arizona, Arkansas, California, Florida, Georgia, Idaho, Louisiana, Mississippi, Nevada, North Carolina, South Carolina, Tennessee, Texas, and Utah. Some more information on this travel-related quarantine should be released from the state within the next few days. In lieu of this, you should have plans to travel. If you have plans to travel, it is recommended to obtain travel insurance as a precaution, no matter where you are going, since other states could be added to this list. Like I said, we are all in this together. we are seeing some counties in the southwestern portion of the state reinstating some restrictions on eating and drinking facilities and reducing gatherings to 25 people or less. We do not want this to occur in Erie County. Let us do our part to keep the number of cases from growing in Erie County. Thank you.
Thank you, David. And now we're going to turn to the media for questions. We'll start with Jet TV today.
Good afternoon, Kathy. This is Star Bodie. My question may be for Mr. David George in regards to children and students heading back to school just right around the corner. Go ahead and talk about how wearing a mask outside a recess or even in the lunchroom, how this is going to take a toll on children socially.
Yeah, it's going to be difficult for them. It'll be a challenge to get used to. Hopefully schools will be able to come up with a creative and fun way for children to wear masks, maybe have mask decorating parties, and make it a good thing and positively encourage them to wear masks. And it will become the new normal. I know Governor Wolf said this mask mandate will probably be around until there's a vaccine. So if schools can come up with a clever and fun way for kids to wear masks, I think that would go a long way with a positive attitude around it.
Thank you.
Okay, thank you.
Thank you, Star. Erie News Now.
Hi there, Kathy. John Laddick with you there today. Although the cases have been good so far, and hopefully those continue, has the county set a standard or a tipping point for the potential to roll back restrictions, like down in southwestern Pennsylvania, if we reach that point?
Well, we certainly are watching Allegheny County and the surrounding counties very, very closely. We know that many people from that part of our Commonwealth do come up here a lot to use our beaches, boating, fishing, all sorts of activities. And so it's concerning. And so we don't have a specific number, but we are certainly keeping an eye on our data, and we will be very carefully monitoring that. If we see us getting anywhere near a big outbreak like they've seen in Allegheny County, we would be looking to implement similar strategies in terms of closing down, not going back completely to yellow, but doing it more targeted closure. But again, it's going to be up to the people of this community and those who come to visit us to help us to not have that happen. And the best thing you can do for that is to wear your mask and keep 6 foot away from people.
Thank you.
Sure. Erie Times News.
Hi, Kathy. It's David. Want to talk a little bit about, the cases that you've seen. I know the numbers are up a little bit the last couple of days. Not, like anything compared to Allegheny County. But are you seeing, are the health department folks seeing that anything's tied to these large-scale events that we're seeing at Presque Isle, that we're seeing in certain parts of downtown Erie where there are large groups of people gathered without masks? Or is it still like it was a while ago, a lot of small gatherings in homes that are connected to a lot of cases?
So far, I've not heard anything specific to, some large gatherings like maybe they've seen in Allegheny County where they've been able to tie it to even specific bars or specific gatherings. And so, some people talk about neighborhoods having parties or backyard picnics, graduation parties, all those type of things. They're happening, I would say, in every community in Erie County. And so we're not seeing it in one specific area. We're seeing it just generally that people are out and about more and they're not being careful. So it's not targeted, it's just much more generalized, but it's happening across the county.
And going back to the Allegheny thing, is there any way that we can, when we have folks coming up to fish and to boat and to vacation up here, is there any education effort going on or anything to help those folks where they're seeing the higher rates, keep them from spreading it to folks here in Erie County?
Well, of course, the universal masking is across the entire Commonwealth, so hopefully everyone understands that and knows when they come from Allegheny, Butler, Mercer, any of those places up here, that the rules are the same, the guidelines are the same. And honestly, I have to give huge thanks and kudos to our businesses, because they are often the entities that we depend on to get that message out. As people try to go into our restaurants or go to use some of our recreational facilities, that they see the masking signs there, that the businesses are enforcing that, and hotels, any of the places where people may go from outside of the community. Of course, we're doing our own social media. We are looking at increasing our presence out there through billboards and maybe some other media sources. So we're looking at a more widespread and longer campaign, because this is, again, nothing's going away. The virus is not going away. Even though we may all be tired of it, it's not going away. And so we are looking at expanding that messaging and trying to even reach more people. Talk Erie?
Yes, good afternoon, Kathy. It's Joel Natale. To follow up on this Allegheny County question, do you anticipate having to have Erie County residents quarantine if they visit Allegheny County, or provide some kind of a restriction for visitors from Allegheny County coming up here?
It's very difficult to restrict. That would require sort of a law enforcement piece that I'm not sure we would be able to handle. But we are following the governor's guidelines, which, of course, as David said, it's highly recommended that if you are in any hotspot, which would include at this point Allegheny County, that when you come back to Erie County that you quarantine for 14 days. And we would ask that also of those who come here to visit. But again, how do we enforce that? That's a very difficult thing to do. So, if everyone will wear a mask, we'd all be much safer. And I guess that's the main thing, and try to avoid these larger gatherings, particularly at bars. Bars seem to be one of the biggest issues that I've been able to understand from Allegheny County. I was actually on the phone earlier today with Rich Fitzgerald, the county executive down there, and he said it really was the bars that were spreading this. And you got to think about when you're in a bar, you're inside, first of all, you're drinking and eating, and so your mask is off, obviously probably quite a bit at the time. Music is usually playing loud, so you're speaking even louder to the people you are speaking to, which we know pushes the virus further out than just if you were doing normal speech. So there's just a whole lot of risk factors in those places. So I recommend stay outside to eat. If you're going to a restaurant, stay outside in a patio or something if you're going to a bar, and try to maintain your distancing as much as you can. But myself, personally, I'm not going to those kind of places, and I would recommend others think about the same. But we can't really stop people from coming here without a huge law enforcement presence that I don't know that we could handle.
Thank you.
Jet TV?
Hi, Kathy. We're 1 month away until the school year, roughly a little bit over than a month. What's the plan for Erie County? Are you guys going to sit down with school officials and get some help or speak to them in regard to a plan?
So we have a team that's been working with all of our school districts. They've been meeting with the superintendents from all 13 school districts. They've been meeting with the diocesan and other Christian and charter schools, and trying to make sure that all the schools have a good understanding of the guidelines that have come from the Department of Education, the State Department of Education. And so we have been doing that. We have some trainings coming up where we will certainly help them with the guidelines, and then also teach them a little bit about contact tracing and what this means and the kind of information that we need. And I believe David George has also been working kind of directly with the school plans. So I'll let David say a few words about this also.
That pretty much summed it up, but we're gonna be meeting with them late in July with both the superintendents and the charter and private schools, just going over the plans. They are to submit the plans to the Department of Education. It needs to be approved by the school board. But we encourage them to look at as many options as possible in classroom learning, the potential to go online learning or remote learning, and just know that it's a challenge, and we don't know exactly what the fall might bring, but we want to be prepared for whatever might come. And that's why we need to keep our options open.
Thank you, Star.
Okay, thank you.
Erie News Now?
Kathy, following up on that, when you mentioned the contact tracing and working with schools or educating them, I guess, in that purpose, is there any plan or thought of providing contact tracers for each individual school within the county as they move forward?
Well, we wouldn't really have the bandwidth to be able to do that, but what we are doing is working with the schools so that one of the things, the students are all going to sit in the same place every day, I guess. Many schools, that's part of their plan. And when they're on the bus, I think they're supposed to sit in the same place. So then you know who the student is actually close to on a daily basis. So let's just say, the one student comes down with a positive case. Now when our contact tracers reach back to the school, they can give them the records of who that student would have had that close contact with. We certainly wouldn't expect a first or second grader to be able to tell us that, but the school district would have that information for us. So that's the kind of thing we want to really work close hand in hand with them so that our contact tracers can quickly figure out who needs to be quarantined. And then that's the other great thing is the schools have moved to much of an online format. Also, those students, if they're not feeling sick, could still, go to their classes and do it from home like they were here at the end of the school year. So there's a lot of things being put in place around that. The universities, on the other hand, we are requiring them to have their own contact tracers, I believe, in their schools, and I think they all wanted to do that anyway, and because that's a whole different population of people coming in, many of them not Erie County residents, not that that matters, but it's just a big influx of additional people into our community, and so the universities are training up their own contact tracers to assist with their student population.
And then just to follow up with one question in terms of contact tracing, have you guys, I know when we talked about this earlier, have you had any difficulties with contact tracing and people maybe not reporting all known contacts because of fear or other issues that they don't want to report?
Sometimes it's difficult. I mean, I think sometimes it's just difficult to remember, right, who you've been around. And we often say if we would all just keep maybe a little daily journal of people you come in contact with, if you ever come down with COVID-19, it'll be a lot easier for us. It's important that people understand it's not a punitive thing. We're just trying to reach out to every person that may have an issue here. So I don't think we're having that much trouble, but sometimes we get more information 1 or 2 or 3 days later from somebody, and I forgot about this person that I was around. So that's really more of the issue. But I will tell you that in one of our recent positive cases, that person has over 50 contacts. That is incredible in terms of the amount of work for the contact tracers. So this goes back to the point of not being in large groups of people, of keeping yourself as socially distant as you can. And if you've had 50 contacts, then you probably aren't doing that. So we need people to think about not only their own safety, but if they do become positive, the number of people they potentially could infect over time is quite significant. So wear your mask and stay socially distanced from people. That is the best thing you can do.
Thank you.
Sure. Erie Times News?
Yes, Kathy, I want to go back to the plans for the colleges and the universities in Erie County. How much talk have you and your staff had with Barron and Gannon and Edinburgh and Mercyhurst about their plans? And other than that, they need to have contact traces. Is there anything else, any other requirements? And if you can kind of just fill me in on that a little bit.
So I don't know the specifics on that, and I'll turn over to David and see if he does, and if not, then we can get you that information. David?
I've been in touch with Gannon on how they would keep some of their equipment clean, keep the public spaces, limit the amount of chairs in the public areas, the frequency of how they would clean them. But I know some other people in the health department have been working with the universities as well. I think a lot of them are coming up with their own plans with some guidance from the health department. And that's what I know.
Okay. Kath, if I can follow up with you on this, one of the particular things with colleges, as you said, they're coming from all over, including, we keep harping on Allegheny County, but we see a lot of students from Allegheny County at our local colleges and universities. How concerned are you about not only having all these young people up here, but also how are they going to be able to not spread illness? They love to gather in large groups. There's a lot of time at night. where they're together, where they're not under supervision of any classroom or on-campus thing. How big of a concern is that to you?
Well, it's obviously a huge concern. We are probably a little over a month away or so, 4 to 6 weeks away from those students returning to our community, and it's a big concern. I think the universities, I know the universities are very concerned about this, and many of them, they may be talking to the health department, but as with most organizations, we're finding that they have guidelines specific to, so whatever organization each university belongs to, they have their own guidelines. So I know I've heard just from my own nieces, for example, the guidelines from the schools that they go to. And so I'm assuming that there's a lot being done there that's maybe outside of the guidance that we would have at the health department. But with that being said, we really are going to depend on the administration at the universities to control the COVID-19 within their own systems. And they, of course, know that they would have a huge problem on their hand if there was a big outbreak on campus. So I know they're looking at COVID dorms, and there's a lot of things being done on that level that I've heard from different universities nationally. So the concern is there, but I think every community, of course, many communities our size and larger, we all have different universities, and we need our universities to step up and lead on this. And I believe that all four of our, I'll say all five, because we have LECOM, the medical school, who also brings a lot of students in. So I believe all five are doing the best they can and will continue to do so. Talk Erie?
Yes, Kathy, want to stay with education for a second and talk about how the plan, at least in the Erie district, is to have 2 children per seat on the buses, and that seems to be some kind of a new idea that came from downstate that many of the school districts are adopting, because any of the other plans that include social distancing to the 6-foot or even 3-foot level are nearly impossible to get the kids to school. What's the reaction of the health department to that? Is this something that the state is authorizing? What do we know about getting 2 kids on a bus seat?
I'm going to have David speak specifically, since he's much more familiar with the guidelines than I am.
So buses is kind of like the crux point of the schooling, one of the most challenging parts of it. And it could almost double the cost if kids were to maintain the social distancing. Do I really think sitting 2 to a seat is a good idea? No. There are the potential options to have maybe a shield in between the 2 seats, but from an insurance standpoint, I don't know if that would be viable if the bus were to get in an accident with the shields in between 2 kids. So this is one of the most challenging things we've had to deal with. They can put that in the plan if they can space out. That would be better, but it's definitely one of the more challenging things we have dealt with. Hopefully we can come with a way to get some other school districts to space them out or have some kids work from home. But if they do have to sit next to each other, face masks are definitely required, and maybe have them try to face apart, but it's definitely a challenge.
And is this being approved by the Secretary Levine? I mean, from what I understand, this model came from downstate.
Each plan has to be approved by the board and then submitted to the Department of Education. I don't know if the state has to approve it. I don't believe so, but as the school governing board is kind of its own entity, and if they approve it, then that's what is required.
Thanks.
I do think it's important to remember in Pennsylvania, we are all our own government entity, and each school board is also in Pennsylvania, although they obviously, when it comes to education, have to abide by PDE, Pennsylvania Department of Education's policies and such. So, but we're assisting the school districts, but they're their own government entity, just like we in county government are and all of our municipalities are. So it's a kind of a different model here in Pennsylvania than some other states, but I commend the schools. They're trying really hard to get the kids back into school and safely. And I'm just going to add one more thing here. If we want our kids to go back to school in the fall, we all need to wear masks. Whether you have children in school or not, whether you're 20 or 80 or 40, if we all wear masks, I think our kids are going to be able to go back to school. But if we have some kind of huge surge in Pennsylvania in the next month or so, it will really jeopardize our kids getting back to school. And I think that's something that none of us want to see. So again, another good reason for all of us to wear a mask. All right, any last question, Jet TV?
Kathy, just touching on tourism over the weekend, I mean, how do you think that went? Do you think the numbers are going to go up from that, from 4th of July and seeing a lot of people at Presque Isle, Waldemere, outside at restaurants?
Outside at restaurants is much better than inside, so I'm glad to see so many restaurants really striving to get more seats outside. Presque Isle, you know, I heard some beaches that weren't real crowded and people felt very safe and social distance, and then I heard some other beaches where people felt they were a little too close together, and the only people they were wearing a mask were the lifeguards and themselves. So I think it was kind of a mixed bag out there. I haven't heard really many reports from Waldemere, but I know Waldemere is really working hard to try to do the best they can, with some rides not being open, with obviously limiting their admission numbers into the park this year. And so again, I think our businesses are striving to do well. No business wants to be associated with a COVID-19 outbreak, but I think each one of us needs to determine what our own comfort level is. So yes, am I worried about a bump from 4th of July? I am. We've had a bump from almost every holiday that's happened since COVID-19 came to Erie County. So that bump normally would occur 7 to 10 days after the holiday, which was Saturday. So we'll see what happens, what our numbers are like starting this weekend and beyond, and see if we have that bump. But I hope it's not drastic, and we'll deal with whatever comes our way.
Thank you.
Erie News Now?
Yeah, Kathy, one last question I have for you. You mentioned the fact that you talked with Allegheny County Executive Rich Fitzgerald. How much from the Department of Health standpoint do counties, at least on this side of the state, have communication with? Say somebody in Erie tests positive and they were around somebody from Allegheny County. Is that upon Erie's Department of Health to report down to the Allegheny County resident, or do you have to communicate with their health department to contact that person?
My understanding is if, say I was positive and let's say I'd been with somebody from Allegheny County, our contact tracers would get that name from me and the contact information, and they would contact that person. So it's that going back and forth. But I will tell you, regular contact between the health departments in Pennsylvania. There are 10 municipal health departments. As we've said, most counties don't have one. On the west side of Pennsylvania, only Allegheny County and Erie County have health departments. So there are weekly, if not more often, conversations between those 10 municipal health department leaders. So they're always sharing information with each other, best practices, et cetera. And of course, there's a regular conversation with the Department of Health, the Pennsylvania Department of Health, who covers all the other counties in Pennsylvania. But in terms of contact tracing, our contact tracers reach out to all of the contacts that a positive would have.
Thank you.
Sure. Any last question from Erie Times News, David?
Yes, Kathy. You had mentioned the businesses have been very compliant. I know that's been the case, ever since we went to the yellow stage. But have there been an increase in issues with customers refusing to wear face masks? At least anecdotally, have you heard of an increase in this? Is it happening on a fairly regular basis that you know of?
It has been happening, and I'll have David speak to that a little bit, and then maybe I'll add a couple things. David?
There has been some increase, and one thing the businesses don't want to do is be too confrontational. Recommend they do some de-escalation techniques and just educate and inform on the mask mandate. If there is customer, they don't want to put an employee in a tough spot, so we don't tell them to be confrontational. Just notify the health department. With regards to informing them, we say have masks on the signs, frequently say over the loudspeaker, wear your mask, social distance, wash your hands, and just educate and inform as many people as possible. And I'd say a majority of the time, people are doing a very good job. It's just those few times that a few people are confrontational and they cause an issue.
So just to add on to that, I just ask everyone in our community, please understand when you go into a business, that business owner is trying to do the best they can. That manager of that store is trying to do the best they can. And if you refuse to follow the guidelines, you're just hurting somebody who's trying to run a business, or you're just hurting that employee who's just trying to make a living. And it's really unfair to that person that you do that. And so I just ask all of us to be aware and sympathetic and empathetic with the people that are serving us in those businesses, and just comply. Put your mask on while you go in the business, and when you go back out, if you can take your mask off, if you go in your car and go home and have your mask off. But it really is a concern to me that there are some people, and again, it's a minority, that are taking it out on the people who work at those businesses, many of them making minimum wage or just a little bit above minimum wage, and just trying to do the best they can every day. So I just ask people to have compassion for their fellow citizen.
And Kathy and David, this is for either one of you. Just a follow-up, about when did you start noticing an increase in these kind of issues happening? Was it when we went green, or is it when the weather got warm?
David?
More recently, I think, with all everything going on in the government, the state government, they tried to revoke the declaration emergency from the state. There's just been just a little bit of heat going on, and ever since then, that's when there's been some confusion, and that's when things got a little heated.
Okay.
Thank you.
Thank you.
And last question, Joel, Talk Erie?
Yes, Kathy. Just back to the contact tracers. We're hearing that maybe some folks are not willing to share names and things because they want their family members to be able to continue to work. Has that been a problem, and would it ever get to the point of what we're seeing down in Rockland County where they're issuing subpoenas to get that data?
We have not talked about that at all. I don't think it's a huge problem for us. I mean, I think there's some isolated cases, but we have not seen that be a big problem here in Erie County as far as I'm aware of. Again, I think most people want to do the right thing. And that's why back when we were hiring contact tracers and we were talking about just what a contact tracer is, and we talked about the qualities of a contact tracer, it's building that trust. And I think we have some excellent people working for us, and they know that the whole thing depends on trust, and trust that that positive person has now with the contact tracer. And so we work really, really hard at the Erie County Department of Health through our contact tracers to build that trust and to be able to really get the information that we need. So I would say it's not been a huge concern here, but there's always isolated cases of that.
Just quick follow-up. Any thoughts of the long-term care facility number of cases? Now we've got 15 or 16 different institutions, well over 100 cases, multiple deaths.
So we always have known that any long-term care facility, or really any residential facility, is a huge concern. You know, whether we're talking about the prison, whether we're talking about a nursing home type place, or whether we're talking a residential care for drug and alcohol, or for a myriad of other reasons why you would live in a residential setting, because people are living in what we call congregate settings. And so that's why we've been very diligent about trying to have the support for those institutions, those residential facilities, and make sure we try to do all we can to keep COVID-19 out. But one of the things you know is many people who work in those facilities work in multiple facilities. So you might have somebody who's working per diem working at 2 or 3 or 4 facilities. You might have certain ancillary services coming in and out of different facilities. And of course, as we've seen COVID-19 numbers increase across Erie County in general, we know that eventually healthcare workers, and particularly those people who work in those facilities, will be some of the people who are infected with the virus and unknowingly, because many people are asymptomatic, take it into those facilities. So yes, we have seen the numbers rise, not to anywhere near to the extent that many other communities have had. And again, I think that's kudos to the Department of Health and to this community as a whole for doing a really good job in the beginning so that all the protocol could be put in place, all the supports could be put in place for these congregate care settings, and they could limit the disease spread as well as, of course, the deaths. And so we know that the state has very strict regulations now with our long-term care facilities. If they're, everyone will need to be tested. There needs to be a baseline test, and certainly if there's an outbreak, the state comes right in and helps with that because they are governed by the state, although we do have 2 staff at the Department of Health in Erie County who do work directly with our long-term care facilities on any outbreak that happens.
Thanks so much.
Okay, thank you. Well, thank you all for joining me today. It is a day also when I always like to bring up the census. As we know, the funding coming in to Erie County for COVID-19 is all based on the census numbers that came back to us almost 10 years ago now. And the response so far for this week is 70% of households in Erie County, so we inched up just slightly. The city of Erie is still sitting at 61%. So I ask everyone to please complete the census, calling 844-330-2020, or go online to my2020census.gov today. Do it today. It takes not even 10 minutes to do. And so please promote this to everyone that you know, family, friends, neighbors, coworkers. Ask them, did you fill out the census? It's really important. We could potentially miss out on $2,100 per year if you don't get counted. And that's not just 1 year, that's every year for 10 years. So if you ask them that and give them the reasons why, then hopefully they will know that it's important and go and do that today. So in the meantime, I ask you all to please, please, please wear your mask. It is the most important thing that I can ask you to do and that you can do for the community as a whole. I ask you when you're out and about, please keep 6-foot distance away from those you do not live with. Wash your hands with soap and water frequently and use hand sanitizer when you can't wash your hands. And please always stay safe and stay calm throughout this pandemic. Thank you.